Good morning, guys. I hope we're all sparkly. It's time for another video. Why? Because I've been instructed to do a video about transfer of care. If you're unhappy with the level of support and care you're receiving from another private provider, we've simplified the process of transferring your care over to the Men's Health Clinic, where you'll be under the care of myself and Dr. Williams. We will be your primary doctors. No case managers, no support workers. No, you'll receive clinical advice from myself and Dr. Williams. Yeah, both doctors. And you'll get clinical administrative support from our clinical admin team. So yeah, you're going to know who you're dealing with. There won't be a faceless hi. No, yeah, it's me and Dr. Williams. So what have we done? Why have we done it? Well, because everybody wants convenience over effectiveness, but we're going to give you convenience and effectiveness. Because if you're already on a protocol that involves injections, you don't necessarily need to come and see us. Now, we like you to come and see us anyway, because we want the personal experience. I want to see the whites of your eyes. I want to make sure that we're acting in your best interests. But you've obviously gone down that road. You've gone down the road of having testosterone deficiency diagnosed with 2 blood tests. You've gone for the path of least resistance, found out actually that's not what you need. And you've gone, why are these guys just throwing more at me? Why are they telling me to take a Arimidex? Why aren't they looking at me as a human being? Now, TRT is complicated. It's about careful dose titration according to effect to get you where you need to get to for your normal physiology to be allowing you to work hard to do what? To earn your reward. And if the company doesn't know you, the company doesn't seem to be particularly interested in you, it can be quite disheartening, because the symptoms of low testosterone can be pretty troublesome. Low mood, anxiety, brain fog, low libido, the list goes on. So you want to get better, and you want to get better in the quickest amount of time possible and without road bumps. Now, as I said, it's not that easy. So we start your dose and we titrate it according to response by looking at the quantitative numbers, but also talking to you and seeing actually, does this sort of fit? Is there anything else going on? Do you have any comorbidities that are complicating the issue? What's your sleep like? What's your nutrition like? What's your training like? What's your mindset like? Because again, you have to have a holistic approach to this, because it's not just, here's your testosterone, you'll be golden, because you are unique, not special, unique. And your dose needs to be carefully titrated according to effect to get you where you need to get to. So sometimes always taking the path of least resistance is the wrong way to go. But again, you want to get better, and we get that. So if you're unhappy with your current provider or TRT service, listen, come to the Men's Health Clinic. But you can actually come to the Men's Health Clinic virtually. As I said in the last video, we are conducting new patient online consultations. Now, you can also then obviously transfer your care across to us via a remote online consultation. Because what are we going to do? We're going to dial you in properly. How are we going to dial you in properly? Well, we know what we're doing. So if you do need daily injections because you're a low SHBG guy, you're going to need daily injections. If you can tolerate a less intensive injection frequency, we will advise you. But we will always be acting in your best interest. Well, I only want to do it once a week. Well, you can't. I want to do it twice a week. Well, you can't, because you won't get stable levels. Well, my trough levels are, yeah, but your trough levels at the very moment. So again, SHBG is probably the major determinant of injection frequency. And anyway, listen, I've got high normal SHBG and I inject every day. Why? Because it's the most effective way of mimicking physiology. And I want testosterone replacement therapy to mimic how my body functions, to then allow me to put work in to feel good. I don't want the high and low, the peak and the trough. Can you feel subjectively okay with less intensive injection frequencies with a high normal SHBG? Yeah, you can sometimes. So why don't I want to do that? Well, because I want the best and I demand the best. Always. I never compromise. But sometimes life is about compromise. It's difficult. We're going to move on to being nice, because I said to Lydia, I'm sick and tired of being nice. And she said to me, you should want to be nice all the time. I said, well, I do. So how can I be nice all the time? Well, What are you doing when you're being nice? Well, you know, you're tending more to the feminine. And what's that got to do with? Well, that's got to do with estradiol and estradiol's relationship with serotonin. So I'm being nice to everybody all day long, and it's exhausting. Again, it's not because I don't want to be nice, but what am I? I'm a man. I'm a testosterone. I've got dopamine. I'm reward driven. I'm goal orientated. I just want you to listen to me. I don't want you to find a solution. Have you heard that before? No, we want to find solutions. So here at the Men's Health Clinic, we're fans of tough love, because you need to hear tough love, because tough love will get you to the goal, get you to the end. You don't want to hear sorrow. You don't want to hear sympathy. You want to hear a little bit of empathy, obviously, a little bit of understanding, but we want progress. So progress comes from tough love. You'll be told what you need to hear, not necessarily what you want to hear, but it'll be delivered in an empathetic, not sympathetic way. And again, that's one of the fundamental reasons why we like that face-to-face consultation. Because how many times have you written an email in anger and not really meant it, and you have a conversation with that person and you wouldn't have said it that way, and you have a conversation and actually it's quite amicable, and you come to a solution because, again, you have that dialogue, that open communication, which allows you to find a solution. Whereas you'll write an email and it's all very angry. And why is it very angry? Because you're not dialed in. Well, you're not dialed in because of lots of reasons. Because it fundamentally, if it's a long email, it's going to be because of estradiol. It's pretty much always because of estradiol. But again, understand that not everything is about testosterone. So if you've got the missus in your ear, you've got lots of work stress, you've got money stress, all of these things are going to be impacting how you are right now. And we talk about the necessity to be focused on the moment. And how often are we focused on the moment? Well, as men, we would like to be focused on the moment all the time. Women, you can multitask if you like, but we don't want to multitask. We want to be focused on the moment. Lydia said to me today, she said she had a wonderful drive to the Brecons the other day, and she hasn't driven for quite a long time because she doesn't need to. So she's been on a phone while she's in the car, and she's doing multitasking again. But when you're driving, you're focused, and obviously there's an element of danger involved in driving, so you have to be focused. You can't be distracted by the things. But obviously thoughts come into your brain. And thoughts come into your brain, and what's going to happen? Well, you're going to be more focused because you're focusing on something as well. So again, it's that momentum that you need. You need to be building on these little wins. So that element of danger is actually good. And this is especially good for blokes, because men, we're testosterone driven, dopamine driven, reward driven. And we're all very safe here. It's all very dull, isn't it? You know, if you're on your computer all day long, or you're talking to somebody, and you're trying to find a solution, when actually what you want to do is go, right, fucking do this. But you can't say that. You have to be empathetic. And it's like, well, okay, well, perhaps if we negotiate and do this, Again, it's a challenging endeavor to be sane in this modern world, which is why men engage in risky behaviors. So, you know, whether it's when you're your youth and you're a naughty boy and you do X, Y, Z without incriminating myself, you know, you're having that element of danger that you're desperately seeking in a safe world, because you still have those primitive drives. Now, as you get a bit older and wiser, you engage in more positive pursuits, like climbing a mountain, just doing other things. Oh, no, I'm not on a list anymore. But in essence, you still need that element of danger. So I train every day, which is probably overtraining to be fair, but I need to lift weights. I need that physical activity, that physical potential for danger, to then allow me to cope with being nice all day long, because I do want to be nice, but I also have to recognize that I'm a man, and man needs danger in a safe world. So I have to have that self-imposed, determined danger. And perhaps that's going to the gym. Perhaps that's an ice bath. Perhaps that's going for a high-cut penny fan. There are lots of things that you can do that will positively impact your body, to impact your psychology, to allow your emotions to be positive. Because again, fuck your feelings. Your feelings are there to protect you, and you're already protected in a safe world. So again, allow your behaviors to positively impact your emotions. Because again, we're about We're about all our emotions. We're about feelings. It's wonderful, isn't it? It is all about feelings, but it's not all about feelings. Again, your consciousness has this reality to survive in and appreciate. And again, we talk about appreciating the moment, because the moment's all that matters. But it's a challenging endeavor as a man. 3/4 of all suicides are in men, but men have it easy. Doesn't seem that way, does it? If 3/4 of all suicides are in men, it's because we don't understand our role. We don't understand our place. We don't understand what our bodies need and what our brains are telling us. It's not always true. It's very rarely true. So again, your brain's there to protect you from what? All that psychological nonsense. So what is it? Be more physical, to improve your psychology, to allow your emotions to be positive, to allow you to understand that we are one consciousness, experiencing itself subjectively. So lead by example, be a role model to yourself and to others, and do what? Earn your reward.